Welcome, my name is Mark Draelos, and I am pleased to present our paper entitled Real-Time Image-Guided Cooperative Robotic Assist Device for Deep Anterior Lamellar Keratoplasty. Deep Anterior Lamellar Keratoplasty, or DALK for short, is a new form of corneal transplantation. In contrast to the standard penetrating keratoplasty, or PKP, in which all three corneal layers are resected and grafted, DALK only replaces the top two layers. Consequently, patients undergoing DALK experience fewer comorbidities, primarily due to the avoidance of immunosuppression and the reduced risk of eye rupture. The downside is that DALK procedures fail in up to 59% of cases. To complete DALK, surgeons must insert a needle through 90% of the corneal thickness without penetrating the endothelium. Shallow needle insertions result in incomplete stromal resections, whereas endothelial perforation requires conversion back to the standard PKP. Surgeons must overcome both visualization and manipulation challenges to reliably succeed at DALK. From a visualization standpoint, a top-down surgical microscope view, such as the one shown on the top right, simply does not provide sufficient depth perception to accurately gauge needle depth. Even if surgeons had cross-sectional imaging, such as that shown on the bottom right, positioning the needle to within 25 microns inside the cornea would push them to their dexterity limits. We propose a cooperative DALK assistant that jointly addresses the visualization and manipulation challenges that surgeons face. The system consists of a robot-mounted needle which the surgeon guides cooperatively under light microscope and optical coherence tomography guidance. Cooperative control is accomplished using a force-torque sensor at the robot's end effector and control software that implements a force-velocity control law. Shown here is a blue artificial anterior chamber used for replicating intersurgical conditions during corneal transplantation. The surgeon can dynamically adjust the robot's compliance for both gross alignment and fine positioning using a gain throttle. To evaluate our system's performance, we conducted a study in which 3 volunteer operators performed 24 needle insertions in ex vivo human corneas. Half of the needle insertions were performed freehand, as in standard surgical practice, whereas the remaining half were performed cooperatively with our system. Needle insertions performed cooperatively demonstrated an 84% improvement in final perforation-free needle depth over the manual needle insertions. Furthermore, there was no statistically significant difference in the rate of perforation. Increased final needle depth correlates with success of the transplantation procedure. Thank you for your attention.